మా వైఫ్ పేరు కల్పన, మా బాబు పేరు ఆదిత్య. ఆయన పుట్టినప్పుడు మాకు మా కడుపులో చెప్పాలి మాకు ప్రాబ్లం ఉందని. డెలివరీ అయిన తర్వాత చెప్పింది మాకు. చెప్తే మేము వేరే హాస్పిటల్ నుంచి ఇంకో హాస్పిటల్ పోతే అక్కడి నుంచి ఆ హాస్పిటల్ సర్జరీ లేదని సునీల్ సార్ పేరు చెప్పాను. ఆ హాస్పిటల్లో కలవాలి, సునీల్ సార్ని కలవండి, సునీల్ సార్ చెప్తారని చెప్పి మేము డైరెక్ట్ ఇంటికి వచ్చాం. వచ్చిన తర్వాత సునీల్ సార్ని కలిసాం. సునీల్ సార్ని కలిసిన తర్వాత మాట్లాడిన తర్వాత సర్జరీ గురించి మొత్తం ఎక్స్ప్లెయిన్ చేసిన తర్వాత మీరు ఒప్పుకుంటేనే సర్జరీ చేస్తాం, లేదంటే లేదని చెప్పినాం. మేము ఓకే అని చెప్పినాం. సర్జరీ అయిన తర్వాత ఐసీలో తీసుకున్న తర్వాత ఇన్ఫెక్షన్ అనేది వచ్చింది మా బాబుకి. 15 రోజుల దాకా ఇన్ఫెక్షన్ ఉండే. తర్వాత అంత ఐసీలో మంచిగా నర్సులు అంతా చూసుకోరు, మంచిగా హ్యాపీగా ఉన్నాం. ప్రస్తుతానికి అయితే మంచిగా చూసుకున్నాం. ఇన్ఫెక్షన్ పోయింది. ప్రస్తుతానికి మా బాబు మంచిగా ఉన్నాడు, అందరు హ్యాపీగా ఉన్నాము. సునీల్ సార్ టీమ్కి, మీ నాన్న టీమ్కి థ్యాంక్ యూ.
So this baby who was 10 days old baby was admitted in our ICU and was referred from some other hospital. Father's some relative was operated by me, so they referred this patient to me from some other hospital. When the child came, child was 10 days old and having severe respiratory distress with saturation of around 70 to 75%. Echocardiography was done and the diagnosis was Transposition of Great Arteries with intact interventricular septum and a large AST and large PDA. So we evaluated preoperatively and taken up for surgery on 11th day of life. Surgery went well. There was no major issues during surgery or immediately post surgery. On first post-op day with minimum inotrope, patient was extubated. 24 hours child was doing well and then slowly started deteriorating. When we sent the culture reports, both ET and blood culture, throat secretions and culture of the blood, we found that Serratia is growing in the blood as well as in throat secretion. Unfortunately, child got re-intubated and was on ventilator. Then we consulted the ID team. As per their advice, we started antibiotic as well as prophylactically we started antifungal. For almost 15 days, the child's platelet count was somewhere between 5,000 to 10,000. It never improved. But our team was behind the treatment for a long time, along with consultation from the pediatricians, from the ID team. So finally, after 17 or 18 days of surgery, child started recovering. So came out of ventilator, inotropes were weaned off, feeding re-established. And when we sent the culture again, the repeat culture, it came out to be negative. So the child improved, oxygen came off oxygen, the platelet count improved to 3 lakhs, white cell count improved, child was afebrile, and ultimately today we are able to discharge the patient. Parents are very happy, even though it was a stormy post-operative course because of infection, but from surgical point of view, after discussing with the echo report and the outcome of surgery, the parents were very happy. Even now also they are going with a happy mood and the child is doing absolutely fine. Hopefully in the future also the child will do well. This is a surgery which is a very complex surgery called arterial switch operation, where we reroute the great arteries from its anatomical position in the diseased condition to its normal condition. That means normally from left ventricle aorta arises and from the right ventricle pulmonary artery arises. In this condition, in the transposition of great arteries, the aorta arises from the right ventricle and the pulmonary artery arises from the left ventricle. So in the during surgery, what we do, we just switch the arteries and bring it back to the normal condition, which is a very complex surgery. And that too, when you are doing this surgery at the age of 10 days with the weight of the child, which is 2.1, 2.2 kilos, it makes it very complex. But one good thing is, once the child recovers, goes home, it is a lifetime cure. They do well in the future and lead normal life. Thank you.